a full room of many students here. MPH students, raise your hands. Excellent to see you. Doctoral students, we have a whole crowd, so it's really great to see all of you, and we have faculty in and coming in. So Angela, you want to stand up? Jennifer, Ron, thank you very much. Tom, who runs everything for communications. So anyway, hi everyone. I'm Kathy Sikkema. I'm the chair of SMS, in case some of you students don't know that. I'm very excited to have Seth Prins do our food for thought. Let me just say, are you guys really hot? That's why you're fanning yourselves in the front. We're doing the best that we can. Maybe not the right room. Where are you going? I don't think it's us. Do you ever feel like you're all of a sudden in a sitcom? That's kind of how I feel today. Anyway, let's get on with getting Seth introduced. It's great to have him for our food for thought for today. Many of you may know Dr. Prins. He actually has a long SMS and EPI history in terms of having gotten a master's degree from SMS, a PhD from EPI here at Malman. He was on a couple of different training grants related to clearly related to his line of work, which he'll talk with you about. Maybe I'm going to give him a relatively short introduction so you can learn about him through his work. He's now an assistant professor in the Department of Epidemiology as well as SMS, and he really has had a long-standing line of work related to criminal justice, a focus on adolescent substance use and mental health. He has a K01 in that area. He's working with some of our doctoral students who are interested in this area. So those were the key things I wanted to say about you, Seth. If I missed something incredibly important, we'll pick it up in the wrap up after we hear about your work. So certainly a topic of great interest and importance and relevance. I think you could even take half of the title and realize how important it is, but the connecting of the school to prison pipeline issue, and then with the specific focus on adolescent substance use and mental health. So Seth will talk for probably 40 minutes, and then we'll have a good amount of time for questions after. If it's really earth-shattering to ask, Seth can decide if he wants to take the question, okay? All right, thanks everyone.
Thanks so much for having me. And yeah, if any sort of clarifying questions come up, feel free to interrupt, but any comments or more substantive questions we can hold to the end. So yeah, today I'm going to talk a bit about some of the findings that have come out of my research. I think over the past decade or so, the public health consequences of mass incarceration have really reached the forefront of public health discourse. And we now understand that the social determinants of mass incarceration are more or less the same as the social determinants of health, namely racism and poverty. But I think less has been documented about the public health consequences of mass criminalization more broadly. And I think one of the kind of cornerstone examples of mass criminalization is the school to prison pipeline. And so today, I'm hoping to convince you and show you one way that we can think about mass criminalization as a social policy of racialized state violence that starts to operate even in preschool and is caused by disinvestments in public health and education and other social infrastructure, which in turn harms population health. So I'll just start out with this quote from Ruth Wilson Gilmore, who says that, and I'll try to kind of frame theoretically the motivation for this work before diving into it. But rather than mass incarceration being a catch-all solution to social problems, which is something that she's said in the past, what's happened is even worse. It's that the legitimizing force which made the prison system so big has given police incredible power, increasing amounts of power. And what's happened is that certain types of social welfare agencies like education, income supports, social housing have absorbed some of the surveillance and punishment missions of police and prison system. And to further quote the abolitionist activist and scholar Miriam Kaba and Andrea Ritchie, schools have not become safer. In reality, police criminalize, contain, and control youth of color in school districts increasingly devastated by neoliberal economic policies, that have gutted public education and youth programs. The result is that billions have been spent to police schools instead of supporting students. And there's actually been an increase in school-based police violence and youth criminalization. So that's sort of the context and the theory being that, as I'll get into a little bit more, that carceral logics have started to become adopted by other civic institutions like schools. But this plays out in very concrete ways. So over 10 million students in the US attend schools with police, but no counselor, nurse, psychologist, or social worker. But for many adolescents, school is their only source of substance use and mental health treatment. And this is a policy choice to prioritize policing and not adolescent health, and likely has profound consequences over the life course. We know that adolescence is a critical developmental period that's associated with substance use initiation and psychiatric symptom incidents. During this period, schools are the place that adolescents spend the majority of their time outside the home. By 12th grade, 40% of adolescents have used any illegal drug in the last 12 months, primarily cannabis, and nearly 20% facility, and fewer than 1 in 10 adolescents and young adults with a substance use disorder reported any past year treatment in 2019. But more than a third of adolescents who do access any mental health treatment access it only at school, and they're disproportionately Black and low income. So schools, I think, are, not controversial in this room to say that they're a crucial public health intervention target for substance use and mental health treatment and prevention, and dealing with the consequences for health disparities. But instead, many adolescents experience school as part of a pipeline to their criminalization. And, I think one of the key concepts that'll animate some of what I'm going to say is that the therapeutic philosophy of rehabilitation and treatment that on paper at least, animated much of the kind of approach to corrections and criminal legal system. And it's quite debatable whether that actually ever happened, has been more or less supplanted entirely by this managerial approach, basically administering carceral stocks and flows of people. So the school to prison pipeline, I like to think of it as both a metaphor and as a set of specific policies and practices. As a metaphor, the school to prison pipeline is really a constitutive component of the neoliberal transformation of the state, economic austerity in the US, beginning in the late 20th century, and the organized abandonment that it entailed. So government withdrew from social provision, systematically disinvested in poor and working class communities and communities of color. And the consequences of that withdrawal were things like poverty, unemployment, underfunded schools, underfunded social services, and we managed the consequences of that withdrawal from social provision with enormous investments in systems of criminalization, such as police and prisons. And as I was hinting at earlier, these trends affected more than just the criminal legal system. There was this broad shift in governance in which other civic institutions began to adopt carceral logics. And so I think a case has been made that public education took a carceral turn around the turn of the 20th century, and with heightened securitization and punishment, and justified this shift after a number of tragic and very heavily publicized incidents of school violence, including school shootings in the 90s. But this really fed what turned out to be a largely manufactured and racialized crime panic about the rise of so-called juvenile super predators. But the function of schools began to shift and was displaced rather than sort of cultivation and meeting developmental needs to administering the carceral flow of this criminalized population, as the Kant quote suggested. As a set of policies and practices, the school to prison pipeline puts students at risk of juvenile and criminal legal system contact for misbehavior, and makes it more likely for some adolescents to wind up in the criminal legal system rather than receive a quality education. Issues that were once handled internally by school administrators and staff are now increasingly being handled by police. And just to kind of give a macro set of the concrete policies and practices of this trend, over the past 30 years, state and local spending on jails and prisons has increased at triple the rate of spending on preschool to 12th grade education. And over the same period, state and local appropriations for public colleges and universities remain flat, while funding for corrections increased by nearly 90%. And so there are both direct and indirect pathways from school to the criminal legal system. Both of these pathways are fueled by zero tolerance policies in schools, which mandate the use of predetermined consequences, often severe and punitive in nature, that are intended to be applied regardless of the gravity of a behavior, mitigating circumstances, or the situational context. By the late 90s, at least 80 to 90% of schools in the US had adopted zero tolerance policies, more so in communities of color and cities. And both of these pathways are also increasing school securitization, by which I mean dramatic increases in the use of metal detectors, wanding, bag and body searches, security cameras, and other forms of surveillance. So in New York City alone, around 100,000 students, disproportionately Black and Latina, pass through metal detectors and are subject to airport-style security every day that they go to school. So as a result of these policies, out-of-school suspensions have doubled over the past 40 years. School-based arrests have skyrocketed 300 to 500% since the 90s. Roughly 20% of ninth graders are suspended or expelled by 12th grade. Students who are suspended or expelled are 2 times as likely to be arrested in the same month. And this really parallels broader trends in policing and punishment in the communities in which schools are situated, which also experienced rises in aggressive policing and zero tolerance policing. And together, these trends expose some students to what scholars refer to as the mass criminalization of adolescents, and this is a theorized mechanism of structural racism. And as you can imagine, there are enormous disparities that these policies produce. Black students are more than 3 times as likely to be suspended or expelled as white students, controlling for socioeconomic status and the misbehavior. LGBTQ youth have 2.5 times the odds of being suspended. Black girls are 4 times more likely to be than white girls nationally. Students with disabilities and Black boys with disabilities suffer an arrest rate that's 5 times the rate of nationally. And as I mentioned at the outset, there are millions upon millions of students in the US that go to school with police present, but not supportive services or health services, counselors, psychologists, social workers. And if you were to look just at the top, so there are around 30,000 police officers employed in schools nationwide, which is about a 40% increase since 1997. More than 2/3 of high school students attend school with a police officer. And in New York, just the officers that are stationed in schools, they would represent the 6th largest police force in the country. So when confronted with all of this background, I knew I was interested in studying this from a public health perspective. What I found was that really all of the scholarly literature and empirical literature was on the consequences of the school to prison pipeline for academic achievement and criminal legal system outcomes. Most research focused on the demographic correlates of suspension, expulsion, and school-based arrest, it was cross-sectional, and there was virtually no epidemiologic research on the health determinants or consequences of this phenomenon. But we knew from psychiatric and substance use epidemiology that substance use was one of these prototypical zero tolerance infractions for school discipline. There's evidence from substance use and psychiatric epidemiology suggests that these problems like externalizing problems, conduct disorder, aggressive behavior are highly comorbid with internalizing problems like depression and anxiety, and both are associated with substance use. And both externalizing problems and substance use are in turn associated with school truancy and arrest. So it seemed like fairly obvious, but the dots had not yet been connected. Furthermore, zero tolerance and exclusionary discipline, the American Psychological Association had a task force on zero tolerance and found that it was developmentally inappropriate, and that it may tolerate negative mental health outcomes by increasing alienation, anxiety, rejection, and breaking of adult healthy bonds. So my question was, can we establish that this policy and social phenomenon of criminalization is related to the organized abandonment of adolescent health and well-being? In order to do this, we would need to link multiple sources of data for the first time. Ideally, that data would be longitudinal, so we can move beyond the cross-sectional research. And we would want to aggregate student data within schools over time. And so as part of my K01 project, I linked data from the Civil Rights Data Collection, which is a national survey of public schools that began in the late 60s that was actually intended to monitor desegregation efforts, but then later grew to include information about school discipline. The response rate is about 98 to 100% from schools like designated officials across the country. And I linked that with the California Healthy Kids Survey, which is the largest state survey of its kind. It's administered by school districts every other year to 5th, 7th, 9th, and 11th grade students and ask questions about their behavior, experiences, attitudes, and health and well-being. And then we also linked that to the American Community Survey, puts together a custom tabulation of demographic data by school district geographies. So in the end, we had data from 2003 to 2014 of roughly 5,000 schools and around 4 million students. And from this data, we were able to extract measures of school discipline and police contact. So out of school discipline was measured for the duration of the study period. So it's out of school suspension or expulsion. Total school discipline, which included out of school discipline, but also in school suspensions. And then police involved discipline. So referral to law enforcement or an arrest in school. And those data only became available a bit later. And from the California Healthy Kids Survey, we were able to get measures of substance use and developmental risk and resilience. So students reported their use of alcohol, cannabis, tobacco, and other drugs. They reported depressed feelings. And also they reported their perceptions of community, home, peer, and school social support, as well as violence and harassment, their feelings of violence and harassment and school safety. And so we aggregated, because the student data was anonymized at the school level, we aggregated to the school level and we developed mean levels of these factors at the school level and standardized those measures within year. And then from the American Community Survey, we had data on potential confounders, such as the school proportion of Black students, the school district median age, school district median income, unemployment, education, and the percentage of the school district that was Black. we fit multi-level linear models with random intercepts for school. And in the first set of models, we regressed each school discipline measure on each health and well-being factor, lagged by 1 year. And we also lagged all of the confounders by 1 year to try to establish some temporal ordering. And then in the second set of models, we kind of looked at the reverse association. We regressed each health and well-being factor on each school discipline measure, which we lagged by 1 year. So in the first set of analyses, which I conducted with members of SMS faculty and epi-doctoral students, we found that higher school levels of average levels of binge drinking, tobacco, cannabis, and other drug use was associated with higher school level prevalence of discipline measures in the subsequent year relative to schools with lower levels. Again, surprising no one really, I think. And so these estimates ranged in magnitude. So for out of school discipline, for example, 1 point higher on a 5-point scale of school level cannabis use was associated with a 7% higher prevalence of out of school discipline in the subsequent year. And then we also found that higher school level community and school support and feelings of safety in school were associated with lower prevalence of school discipline measures in the subsequent year, and that higher school levels of violence and harassment were associated with higher prevalence of school discipline in the subsequent year. Again, really surprising nobody. And then in a second paper, we looked at the reverse relationships. And this paper included Ruth Scheffner, as a doctoral student in SMS, as well as other SMS and EPI faculty. And not surprisingly, we found that higher prevalence of school discipline measures were associated with higher school mean levels of substance use outcomes in the subsequent year. So, for example, a 1 unit higher prevalence of police-involved discipline was associated with a 0.7 point increase on a 5-point scale of higher school-level cannabis use in the subsequent year. That's this dot here. And again, we found the reverse associations that a higher prevalence of school discipline was associated with lower subsequent school levels of community support, school support, feeling safe in school, and higher school levels of violence and harassment. So despite our attempts to try to get more longitudinal and move beyond some of the cross-sectional data, these studies are still limited by the fact that we're looking at associations. We lagged by years. We're basically looking at to try to get a temporal order, but these are still sort of school level ecological variables, but they're consistent with, I think, common sense, but also that common sense hadn't been documented empirically yet. But it's likely that students that are exposed to material and psychosocial deprivations that are conducive to substance use, mental health problems are probably more likely to get in trouble at school, but they're also more likely to attend schools that rely on discipline and police rather than counselors, social emotional learning specialists, or social workers to manage the consequences of those same conditions. And it's also likely that exposure to high levels of suspension, expulsion, and police contact create or exacerbate those conditions that are conducive to adolescent substance use and mental health problems and reduce risk and resilience factors like those measures of social support. And we hypothesize that these bidirectional relationships are almost certainly racialized. The exploring the racialized criminalization of adolescents was part of the K, but kind of got disrupted by the pandemic when I can no longer travel to access this data. But it's on our agenda still, and the preliminary evidence suggests, again, what common sense also suggests, but these are adjusted main effects, adjusting for all of those same school district and school level demographics showing that the percentage of the school that's Black or Latina is dramatically associated with total discipline. So these are, again, were school level, institutional level findings, and I think it's still important for us to document institutional level and social processes, but we need to be careful about drawing inferences then about individual students, individual level experiences. And so for that, we would need longitudinal individual level data. And based on our prior work, we would ideally also test these reciprocal relationships. So as another part of my K, worked with Ruth and other doctoral students in epidemiology to look at the adolescent to adult health study. And this paper is, we're revising and resubmitting. But this was the first use of this data set to look at adolescent substance use and subsequent exclusionary discipline, as well as the impact of school discipline and substance use on substance use, as well as the impact of adolescent substance use and exclusionary discipline on later adult arrest, criminal legal system involvement. And so our hypotheses were that reported substance use would be associated with subsequent school discipline, as well as the inverse, and that reported school discipline and substance use would be associated with later arrest in adulthood. And we also hypothesized that these results would vary among BIPOC and non-BIPOC students. So this is just a graphical, for those of you who learn better by seeing, this is just a graphical representation of what I just said. So we looked at these measures at wave 1 and measured the outcomes at wave 2, and then again at wave 4. So I won't get into the details of the study in too much depth, except to say that this is a nationally representative longitudinal school-based sample that began in the 90s and is ongoing. Roughly 20,000 students ultimately were selected for in-depth interviews. And the students that of those 20,000 adolescents, they've been followed into adulthood. The most recent wave took place in 2016 to 2018. So we used wave 1 data. So the students were in grades 7 to 12. Wave 2 data, which was 2 years later in 1996, students were in grades 8 to 12, and then the wave 4 data, where the respondents were in early adulthood. And the wave 4 measures of lifetime criminal legal system exposure were inclusive of the wave 3 measures, so which is why we kind of skipped to wave 3. And we looked at wave 1 school discipline, so having ever been suspended or expelled. Wave 2 discipline was the same set of questions, but specifically asked since the last interview. And then we did a measure of cumulative discipline, which was both waves 1 and 2. And then the wave 4 question asked if they had ever been arrested or were currently in prison. And we again looked at a variety of confounders such as birth year, race, ethnicity, gender, a bunch of characteristics about the parents, and neighborhood characteristics. And then we were interested in whether race, ethnicity modified these associations. So just to orient you to the table that I'm going to present in the next slide. So this is wave 1 exposure and wave 2 outcome and wave 4 outcome. So model 1 will look at substance use at wave 1, predicting school discipline at wave 2. Model 2 will look at school discipline at wave 1, predicting substance use at wave 2. And then model 4 will look at school discipline predicting arrest and substance use predicting arrest. And again, not surprisingly, we found that substance use and school discipline were bidirectionally related. Students who use substances in wave one had about twice the odds of school discipline in wave two. Students who were disciplined in wave one had almost 2 times the odds of substance use in wave two, and both school discipline and substance use were associated with a higher odds of arrest in wave four. And when we looked at effect modification by race ethnicity, we actually found, so here I'm just presenting the coefficients of the interaction term. We actually found that being BIPOC versus a white student reduced the magnitude of the effect between substance use, between the substance use and school discipline measures and subsequent substance use and school discipline measures, and also reduced the magnitude of the association between substance use and wave four arrest. At first we were a little confused by this, but when we went back to look at the data, we found that BIPOC adolescents in this sample were far more likely they were far less likely to use drugs than white adolescents, which is consistent with epidemiologic research. But they're far more likely to be disciplined for any reason. And so our thinking on this is that if, because of institutional racism, the threshold for being disciplined is much lower for BIPOC students than relative to white students, then it's possible that this association between any single infraction, such as substance use, would be weaker if they're just getting suspended or expelled because they have racist teachers. So this warrants, I think, one of the limitations of this data is we don't know the reason why students were disciplined, because it's just, have you ever been? So we can't actually link the reasons for discipline, but that's something for future research. So we found some evidence of this reciprocal relationship between school discipline and substance use at the individual level. And these findings, again, are not sort of slam dunk causal inference findings, but are consistent with the idea that school discipline is developmentally inappropriate and may harm adolescent health. And at the individual level, before I talked about how those findings should probably be interpreted about how schools invest resources to respond to certain problems, I think at the individual level, we can hypothesize that exposure to school discipline is likely to break down social bonds, reduce school connectedness, disrupt academic progress. And these are all conditions that might mediate the risk of adolescent substance use and subsequent exposure to the legal system. And we also started to see the role of institutional and structural racism and how it might play out differently at the school level versus the individual level. So I will now kind of present the next steps of this research agenda. So received some pilot funding from CPRC and a Calderon Award to start to look at to try to connect school discipline to the broader context of criminalization and policing in the neighborhoods in which schools are situated. So we linked data and aggregated it to the zip code tabulation area. I'll just say zip code from 2006 to 2014 of the civil rights data collection, again, New York City open data on policing incidents, and the Sparks data set, which is an all-payer reporting system for hospitalizations. So we were interested in inpatient psychiatric hospitalizations among adolescents aged 10 to 24. And we were able to geocode all stop and frisk, arrests, and summonses involving residents of all ages and aggregate them to the zip code level. And then we were also able to use the civil rights data collection, again, to aggregate total school discipline incidents to the zip code level as well. And we use the American Community Survey data again for neighborhood characteristics and potential confounders. So this is the kind of research agenda. For study one was led by Sam Packard, who's a doctoral student in epidemiology in collaboration with Ruth Scheffner. Was looking at whether the zip code policing rate was associated with the rate of psychiatric hospitalization days for adolescents. So how much time they spent hospitalized. The second study, which was led by Zoe Verzani, who is a master's student in epidemiology for her master's thesis, looked at whether zip code policing rate was associated with school discipline rate at the zip code level. And then studies 3 and 4, in collaboration with everyone I just mentioned, are sort of in process. And we want to next look at whether zip code school discipline rate is also associated with psychiatric hospitalization length of stay. And then we want to conduct a mediation analysis of this whole pathway. So just to give you some pilot findings that haven't been published yet. This is a map. These are maps of the concentration of policing incidents, psychiatric hospitalizations, and school discipline at the zip code level. You can see visually quite a bit of overlap. And we found that each standard deviation increase in the rate of policing and at the zip code level was associated with a 4% increase in the rate of hospitalization days. Also associated with hospital admissions, but weaker. It's actually length of stay that has a stronger effect. And we also found that this pattern is magnified for Black residents or neighborhoods with a high proportion of Black residents. So the association between the rate of policing and hospitalization days is about 8% stronger in predominantly Black neighborhoods than predominantly non-Black neighborhoods. That was study 1, policing to psych hospitalizations. This is study 2, the relationship between policing and school discipline, to try to get at this context of the mass criminalization of adolescents. So Zoe in her thesis found that a standard deviation increase in the rate of policing was associated with a 13% increase in the rate of total school discipline and a 9% increase in the rate of out-of-school discipline. So again, this surprises no one that's been on the front lines of these struggles, but provides, I think, some much needed empirical documentation of these phenomena. And not surprisingly, schools in which there are a lot of police and disciplinary issues are most likely in neighborhoods in which there's a lot of aggressive policing as well. And the goal is to figure out what effect this has on adolescent health and development. So the planned analyses are, again, like I mentioned, to estimate the full pathway here. So look at the association between school discipline, adolescent psychiatric hospitalizations, and then determine whether school discipline mediates this association between aggressive policing in the community and adolescent psychiatric hospitalizations. And then beyond that, we want to, psychiatric hospitalization is a severe outcome, and we suspect that these phenomena of criminalization of adolescents likely have more downstream effects for less severe outcomes. And so I've actually submitted a grant to the National Institute on Drug Abuse to actually partner with the New York City Office of School Health to actually link student health records at the individual level to school discipline records, and then bring in community policing context. And we're going to use one of the limitations of this pilot work is that we can't get American Community Survey data for the appropriate confounder variables at a lower level of geographic resolution than zip code. And so we're going to use a microsimulation technique to estimate and simulate some of these confounding variables. And our goal is to really create buffers around schools of like 500 meters and 1,000 meters and look at the intensity of policing around these schools and the intensity of school discipline in these schools. And that's due in a couple of weeks. So I just wanted to conclude by kind of linking it back to the kind of the theoretical framework here that this Vacan, who's a sociologist, calls this a paradox of neoliberal penality. I think others might say it's not actually a paradox, but the way things are designed. But this idea that the state stridently reasserts its responsibility and potency and efficiency in the narrow register of crime management at the same time that it says it can't do anything about economic conditions, such as funding for public education. And so I know that's kind of grim. So I wanted to kind of leave you on a slightly more hopeful note. So this also comes from Miriam Kaba and Andrea Ritchie's book. In the summer of 2020, over 34 US cities voted to eliminate cops from schools. And they argue that schools should be the place where we experiment to imagine creating alternatives to policing. And so imagining and creating police-free schools offers an entry point for conversations about ending policing in all of its forms. What we put in place to create safer schools can teach us about how we can create greater safety in communities through things like investments in public health. And so this is also consistent with APHA's 2018 policy statement, 2019 policy statement to address law enforcement violence as a public health issue. This calls for an approach that targets structural inequities that manifest in criminalized behaviors by addressing the social determinants of health, access to housing, education, employment opportunities, mental health and substance use treatment, things that we know are associated with reduced community trauma, reduced community violence and interpersonal harm, and improved community health and safety. If we can start with things like restorative and transformative justice in schools and get police out of schools, then it's a building block for thinking about getting rid of police more broadly. So I will stop there and be happy to take any questions.
Very excellent line of work, and I have about 10 questions, but there's probably one in the audience that I can talk to later. So, Jennifer's got a hand. We'll do this. We have several minutes, so please just.
Sure.
What was that one thing on Zoom here?
So first, I was wondering if you've thought about other community dimensions that might possibly affect the relationship between police, like libraries, schools, or if you're working in California, anti-immigrant policies as like 287G policies. So that's just a thought, which you've probably already had. And then I was wondering, since we have so many students in the room, if you could talk about your translational work and sort of, because you put up Mariame Kabe's work as if it is entirely separate from you. And so just talk about sort of the other part of moving this agenda forward.
Sure, yeah, thanks. So I think the issue, maybe, yeah. I think the issue of immigration police and immigration policy as an issue of policing is super important. And I think we know that immigration police do show up at schools as well, public schools. So that is definitely a further level of criminalization that will impact certain students. Not something that I've discovered the best data set for yet, but it's absolutely important. And then in terms of translational work, I am sort of waiting to get more concrete New York City data, but since I started the California work, have been in conversation with some local policymakers, State Senator Salazar's office, Congressman Bowman's office is also really interested in investing in schools, investing in prevention, and his Green New Deal for public schools, for example, is directly aligned with some of the implications of this work. And so, yeah, I see this work as sort of being directed toward frontline social movement groups that have been working on this issue for decades, but then also to help translate some of these findings into usable evidence that some aligned policymakers can also use. I'm actually going to be working with some of the progressive state assembly and state senators are going to unveil a tax the rich plan in response to the governor's proposed budget, and we're going to be doing a bit of work with them to sort of talk about how investments in schools and housing and so forth are actually public safety policies.
Well,
Hi, Seth, great, it's all good work. Just some comments from my work and looking at frequent users, quote unquote. These are persons who cycle between jail, incarceration, homeless shelter, crisis care, institutions, inpatient, psych, et cetera, So, and one of the things that we found are the folks that are most difficult in terms of, or most sustained, kind of disadvantaged, if you will, and more often picked up by the police for everyday things, if you will, status, quality of life, sitting on a stoop somewhere in a gentrified area and look a little raggedy, gets a phone call. Anyway, but one of the characteristics or predictors is early, quote unquote, early arrest, early incarceration. And I also want to point out that's a factor in this is then looking at the modeling of whether or not to, sentence people or give them, early release is uses this early incarceration as a marker, and that we do interviews also as well as a data match, and those early incarcerations are for status offenses, skipping school or kind of getting to a fight, over sneakers or something. So I'm just saying this is all good, but the way we get some of this is through, do you work with CIDI, the Center for Intelligence through Data Integration, the city agencies, because they're very, very helpful, and they could bring in jail, homeless shelter, as well as Sparks, which is what we do, but also they have education and Bureau of Child Welfare work too. Just it's local and it wouldn't be as big as the national, but you might be able to kind of get some of the things that you're looking for as missing.
Thank you.
Actually, let me try to ask one thing.
In terms of research thoughts, one thing that I've been thinking about a lot lately is our particular campus and the relationship that we have with the surrounding community, and how we have, security guards at every entrance, and whether that impacts their feelings of safety and security and empoweredness coming onto our campus. So that could be interesting.
Yeah, thank you. There's actually a long history of conflict over that, actually, particularly with the shelter that's across the street from the hospital. And Columbia has at various times tried to close that down and faced opposition from folks in the School of Public Health, actually. But yeah, this sort of criminalization, or what Miriam Kaba calls soft policing, happens not just in grade school and primary school, but also at universities as well.
Thank you so much for your lecture. It was really great. Just a note, in terms of like,
I can't. Sorry.
Oh, hello. Cool. Thank you for your seminar. It was really great. I'm just thinking like international models of rehabilitation. In New Zealand, we have some really incredible Indigenous rehabilitation models that are starting to really inform how we go about the prison system, and especially in youth. So I think there's a lot of value in looking at those different Indigenous models. Yeah.
The restorative justice practices that have been taken up here have been inspired by Indigenous practices internationally. But yeah, thank you.
Yeah, thank you so much for this talk. Really appreciated it. I've also very connected to this topic. Like, I helped organize some of the work unified school district and repealing the police back in 2020 there. So yeah, very pertinent, very necessary work. I'm just interested in whether or not some of this more quantitative research has, if you're thinking about more mixed method approaches to really center the stories of those most affected, to kind of give a balance to the more like numbers and data that is important for policymakers and things like that. But in the way that you're trying to translate it, have you thought about storytelling as well?
Yeah, thank you. So I think it's a very good point, and I think my answer might not be so satisfying, but I think what I saw is the big gap in this research. Like there's a ton of really great ethnographic and qualitative work. A number of books have come out in the past like 4 years, following students through their experiences. And I think what was really missing was some of the quantitative data. And I think when we're dealing with police departments that are known to sort of manipulate data and make up crime statistics and make up all sorts of things, that it's really important for the opposition to come back with its own numbers. But I do, that's not to say that we don't need that work. And I think ultimately, in order for any sort of translation to be effective, it will have to have that storytelling component. So I appreciate it.
I had a question. Spots and clusters around lead and school districts. I was just wondering if you thought about other environmental aspects to the work that you're doing and how that might intersect with your findings.
Yeah, so I think the way that they intersect, for me at least, is in this concept of organized abandonment, which is that the systematic disinvestment in schools and communities, which includes things like infrastructure, pipes, ventilation, asbestos in these buildings. I think a lot of these things became more well known to white people during the pandemic, but had been very well known to communities of color about the quality and conditions of lead paint in the schools and so forth. And this concept of organized abandonment is that the state doesn't just withdraw from dealing with those issues, but instead makes massive investments in things like surveillance, policing, and punishment. And so I think the sort of shared solution to both of these problems is to reinvest in communities and in social and public infrastructure. But yeah.
Time for one more question. I don't think this is working. Can you just talk loudly? Okay.
So when you were talking about the solutions that you were considering, of course, reinvestment is incredibly important, but as you talked about at the beginning, I think carceral logic runs. So I was wondering if you had thought a lot about, like, if you replace police officers with more social workers, but their only option is to call the police, what does that do? Or if you have transformative justice, but they work with police officers, is that really transformative?
Yeah, no, absolutely. And I think, a lot of folks doing this work will distinguish between reformist reforms and non-reformist reforms. And the reformist reforms are the ones that either directly or indirectly end up expanding the scope and power of the carceral state. And I think, we've seen, so we know, for example, that there have been RCTs to show that you can train teachers to be less racist in their application of discretionary discipline. We know that restorative practices work, but we also know that schools are often just kind of they're just like, okay, do this, with no resources, no investments, no training. And so it's up to like a handful of teachers to kind of take it on. But what's really required is transforming the entire culture of the school, school administration and also investing materially in the surrounding communities. And so I think that shouldn't stop us from trying lots of things, but recognizing that we will ultimately need to have big structural changes. Yeah.
That's actually related to what I was interested in, which is what you would flip the resources to. I think that's kind of the same question. And because your work moves it from academic achievement outcomes to potentially mental health and substance use oriented thinking, how you would approach a structural change, like a trauma-informed school culture, like ways that you might actually address mental health and substance use that's not as typical mental treatment approach, but a more structural. That was kind of what I wondered. So I don't get one more comment.
Sure, yeah. So I think this would require not just investing in individual level interventions, but it would also require investing in schools, but also the communities in which schools are situated. And so I think it really requires moving money away from policing and punishment into primary prevention.
Well, thank you, Dr. Prins. It's been a pleasure.
Thank you very much.
On your calendar next month,